Access to medicines is at the core of the heart of HEPS Uganda and at the core of my heart as an individual. I would like to see a country where people do not have to die because they have not received the care that they deserve.
HEPS Uganda is a health consumer organization, and our mission is to increase access to essential medicines for all people in Uganda. Uganda, as we stand now, we have a policy where access in the health sector is free of charge, but that is still not the case. The health centers, they don't have medicines, they're overloaded and they're overwhelmed.
We have a lot of challenges. We are serving overwhelming number, too much workload, while health workers are very few. But even in the utilities, you can see a health center like this one keeping all the expensive drugs which need refrigeration. But we have taken some weeks without power. At times we don't have drugs because they bring like maybe 15 tins of amoxil to this health center. 15 tins will last for only 1 week, and the rest of the days there will be no drugs. Now tell me, if you serve patients for only 1 week, what about the remaining weeks and months?
Sometimes oyinza okujja eddagala notalisangawo ne bakuwandikira ne bagamba genda oligule. Bagamba letayo ssente ate olisoba tozirina n'oddayo nga mwana tebamugemye olw'ensonga oba tolina ssente za kipande. Eddagala libadde lyetaagisa ate ne wayitawo akaseera nga sirina ssente.
The problem is that people who go to government health centers, they cannot afford the private center. So that's why it is stock out, the person will go home and die. And it's unfortunate people will go home and die just because of medicine that costs less than $1.
There have been tremendous developments and improvement in the healthcare system and in particular the medicine supply system over the last few years. But there's still challenges that we still have to overcome. The need for medicines is increasing every day and we're still not getting enough of the money that we need to have an efficient healthcare system.
Funding is not the only problem. It is inefficiencies as well as the lack of transparency. We want transparency along the chain, so if funds come and they go to Ministry of Finance, how much of that approved budget was actually disbursed to the Ministry of Health? How much of it went to national medical stores? You know, if this should be public information so that we all know.
This is National Medical Stores, 100% owned by Government of Uganda, and this is where all the medicines and medical supplies that go to the government health facilities start their journey. We have 5 zones in the entire country. All the 112 government districts are within here. We deliver once every 2 months to the districts. So we have 6 cycles. As you can see, the space is getting smaller. All these should be in the shelves. All the shelves are full. There is no free space anywhere.
Are there any drugs or medicines or supplies that you have too little of?
Too little of? Not anything that we know. Not anything that we know.
Other issue, very controversial also.
Yeah.
That a full store is not a full store.
Yeah.
It's amazing that we have all these medicines here.
Yes. Some people say the medicine should be in the health facilities, not here. But as I can tell you, if you are serving the entire country and you do not have enough medicines at the center, you are in problems.
Here in Lira, We have a problem of inadequate quantities of medicine, and this is affecting access to health services. And we think that if the budget for medicines is increased, it will address the gap of access to health services. The national budget was allowing the equivalent of about $9 per capita. We are aware that the World Health Organization recommends the country should have $40. If you're having a quarter of what you should have, then you can't expect to have enough.
This is a government hospital, so everything here, all the services are free of charge. It is important that the medicines are free so that every person can afford and have access to it. The drugs are brought every 3 months on a quarterly basis, so it depends on the number of patients we receive in a month. If there are very many cases of malaria, which were treated within that period, and then before the 3 months has elapsed, the drugs are over. That is a very big challenge for us. So we would like to treat them, but they have to buy their drugs. But it is hard for them to afford. So that is a very big challenge here. This is a health center there was supposed to be a doctor, but there's no doctor here. It is a big problem, and there's shortage of doctors all over. All these patients you see here, they are waiting for treatment. They are waiting to get their ARVs. They have come for refill. They come in hundreds.
Lono Dulu Joffrey, Anaya Haliro, Ikola district, O Meya Wepashu, Ubino Kerigali. Eya Pashu Bore Meya Pashu Bino Kanti kilometer Abiro. O Kokone no, Dagatala Metiborwa Purber Dagatala Puyu Don Bakan, Pien Borakuya Vipotero, and me wando Quanyokar Meya Bunaka, Ogu. Ya dong yi kore kujute binu gurgan.
Yara no te monyo ne tumuga. En ya to choy ne dan kai na pe no. Te ki cha eno dok ku ro wele kan na ro kan clinic te ya ta come pe. Ikin yena no wana choy ne.
Here at HEPS, we have been monitoring access to medicine since 2005. And over a period of time, we realized that the issue of stock out of medicines was actually a national problem. And we launched a national media and community campaign to raise awareness of the problem of lack of medicines in health centers. And 1 or 2 years down the line, we see an improvement. So you can see that actually something can be done. Service delivery can be improved in this country.
There is a lot of hope that there will be change in the health system. We are seeing a growing number of citizens that understand what the problems are at their health centers. We need finances, not only for medicines, but to see that the issues surrounding medicines are handled. As Ugandans, we've been given free medicines in our public health facilities. We need to go and access these medicines, and if they're not there, we need to hold the duty bearers accountable.
First of all, what the community can do is to know that the health center is theirs. It was put there for them. So therefore, they should be able to express themselves, register their complaints, work together as a community through their local leaders and communicate their problems to the districts. If this is done across the country, we have seen that government is able to respond. Government means people, and people, it is me, it is them, it is everybody. So once we give out this community, once people come together as a community and they speak as a community, we believe that something can be done.